but also seeing what kind of technology would make sense for a nurse versus a supervisor versus, for our providers versus med assistants. So it's really looking at almost role-based access on how they would use it.
Welcome to the Risk Never Sleeps podcast, in which we learn about the people that are on the front lines delivering and protecting patient care. I'm Ed Gaudet, the host of our program, and today I am pleased to be joined again by Steve Ramirez, the Chief Information Security and Technology Officer at Renown Health.
Steve, glad to be here.
Welcome back.
Great. Thank you.
Yeah. So welcome back. By popular demand, we had a lot of folks that were interested in your last episode.
Best way to be. Yeah.
Yeah.
Glad people watched. So yeah.
Which we talked in October. So I'm sure a lot's changed since then. And no pun intended. What's new with you?
A lot has. So, especially with Change Healthcare, I know that was the biggest thing a lot of CISOs across the industry were looking at. So I know we talked about third-party risk and access, and that was, really those themes played over to what happened with Change Healthcare. So I think that really brought to light a lot of healthcare organizations have been focused on patient care operations. And I don't know that we would have ever thought something like a exchange or anything like that would be and the vast impact that would actually provide or downstream it would do for a lot of organizations. And then having a lot of eggs in one basket. We realized that for some of these critical services that we need to start having backups for backups.
Yeah.
And really going through our holistic process, that we were just scratching the surface on third-party risk. So I know that it's really important that we didn't even really have a third-party risk assessment, because we were going back and switching tools and going back to really look at that. And we're going back holistically, doing a lot of our lessons learned. We're like, really, how do we measure up like our business continuity side, like our most critical vendors, our critical applications and services from that vendor with some of our high risk vendors? Having a dashboard to be able to maybe have that foresight and crystal ball into some of these components might have changed some of our response and our overall business continuity planning. But I think that Change Healthcare just definitely brought to light the necessity for a strong third-party risk program. Not only just doing the assessments, but also the mitigations and then the downstream supply chain risk. So that's getting into how that can impact your business and making sure they're not a single point of failure. So can you have, multiple service offerings to that, backups? Like we know we pivoted from like some of the tools that they were using on the pharmacy side over to the McKesson side because they have a RX offering, just because of the sheer vast impact to all of that. I know a lot of other health systems were more impacted than us specifically. We had a health plan, so that was probably our most impacted, as well as our pharmacy processing.
Yeah. And how quickly we were able to start recovering from the event?
I think this was a good lesson also on HIMSS and putting together your incident response and bringing these players together and shining into light that the importance of third-party risk and contingency planning, because you're basically living and breathing it day to day. I'm like, okay, this isn't working. What's our workaround, or what are the vendor partners can we look at? We had a lot of workarounds we were able to do. I know we were a long time customer of Change, especially on the health plan side. So that gave us a little bit more flexibility to start to do some of their rebuilt systems, getting on that list earlier on. But that we were just looking at other vendor partners' workarounds, manual, good old-fashioned way of calling pharmacies, paper scripts, doing the old-fashioned insurance verification. So again, that's the importance of downtime procedures. So I think we were able to test a lot of that. But again, we were impacted, but not as impacted as others. But it was a good, lesson learned and exercise to go through that for this event, but, to prepare for other events.
And to your point about business continuity and being able to recover, not just bring the program up, but also have alternatives that you can draw from right out of the gate, I think is a real lesson that we can take from this event as an industry.
Definitely. So we're looking at backups to some of these critical services and actually doing an exercise to start to holistically look at our top vendors, our critical vendors by service line, and then tying that into our riskiest vendors. So if we have somebody that says your top 5 in, say, our surgery pharmacy line, our surgery service line. And then based off of those 5 they give us, do we have all the risk assessments for them on file, and where do they really rank on that? Because we're starting to look at putting together profiles by work stream like that to then say, surgery has this kind of score, pharmacy has this kind of score, med surg, really looking at how we can help the business make, more strategic discussions when we're looking at advancing things in our strategic plan. So that's something that we're really scratching the surface. And I'm spending a lot of time with our chief analytic officer. Him and I actually went to HIMSS together to look at some of our technologies together. And he's helping me create tons of dashboards because, the best way to make decisions is having the data. Yes. So he's been a great partner and taking data from here, data from there, and kind of combining it together. So him and I have been lock in step on really putting together a lot of this to have more data-driven risk
insight
decisions throughout the organization and bringing that to our governance, risk, and compliance committee, our audit committees, et cetera.
So you went to HIMSS. How was it?
Great. It was the most packed I've seen it since pre-COVID. So
wow. No
awesome.
Kidding.
Yeah, the floor was pretty exciting. There was a lot of great events. It was great to see a lot of vendor partners and fellow providers in person. So I went to the Cybersecurity Forum, but also went to the CXO. So to go in there and see what's going on the innovation side. So I think that really the biggest takeaway was AI automation. We're looking at 5G. So really as being tip of the spear on different, network connectivity within the hospital. So working with some partners on that. But yeah, it was definitely AI took everywhere we went. That was, really the key topic and takeaway from everything. So.
No, I love that. And did you go to Vive or just HIMSS?
Just HIMSS.
Just HIMSS. Okay. So at the end of last year, the HHS had announced new cybersecurity performance goals. How are you thinking about those over the next 12 months?
I think it's great that they've done that. It's, very similar to like what the 405D and HICcup has done to really make things more palatable and bite-sized key areas to look at. So what we did was look at what the essential goals are, looking at where we aligned, and then doing a crosswalk to our NIST CSF, and then really painting the picture of those risks mitigated. And I know they break that out into two different pieces from the essential goals and then the enhanced goals. So that's really going into our roadmap to make sure that we're really covering all these various baselines, not recreating the wheel. I know there's crossover from, the NIST CSF, but making sure from the HICcup and these new performance goals that we're really making sure we're covering everything, because they might become mandatory at some point, I would envision. So making sure that we stay ahead of the curve and just putting that into our overall program documentation. So
yeah, I know high probability that will be, they will become mandatory. That'll be true. So given your first look, how are you doing in terms of coverage?
So from the essential goals, it's looking like we're attaining all of them. It's just about our maturity to all of those, similar to NIST. So I'm just continuing to build that maturity. We're hitting 3s usually in that, very high 2s, maybe in some of them too. And that helps us really put together our roadmap, maybe on looking at things that we weren't looking at from a different lens, from just the vast pieces that NIST puts together. So that's, something also when we're doing our roadshow with the business to really help show the importance of what we're doing with our technologies when we're vetting our third-party partners, et cetera, on that, to really show them that I think this is a good way to show some of those key fundamentals in security. So
I love that. And as you look at new technologies such as AI, how do you think about bringing AI into your organization? And what have you done to date to help with risk mitigation, or at least risk identification?
So when the buzz of AI came out, I guess, middle of last year, we came together as part of our governance, risk, and compliance, our GRC committee, to really look at how we wanted to tackle that holistically, starting with ChatGPT and all that. We're pulling telemetry on how much it was being used. And we thought that we would maybe take more of a backseat, not that we don't want to be innovative and utilize it, but we're not going to be creating our own AI technology in-house. So we're taking the stance that we're more going to go with when Epic releases AI-based modules, or Microsoft releases Copilot like they have, that we're going to start really crawl before we walk with some of these embedded and baked in tools from some of these trusted partners, versus us trying to think we're going to be bleeding edge and create our own technology, because that's where we'll really get into higher risk scenarios. If we're trying to do stuff on our own, how we're protecting data and looking at all these different fundamentals that we need to put into place. So we're really taking that kind of more liberal approach, or conservative approach, I would say, to just making sure that we're utilizing these tools as they come out in some of our more trusted partners with, again, Microsoft, Epic, and other pieces like that. And it's going to just come out more and more. Same on the security side. There's, some machine learning that it's been doing for a long time, but we're treating the intake of that no different than any other new vendor or technology. That if we see something as part of our process that is AI based, that goes to myself, our chief analytic officer, and our VP of IT applications. So the three of us look at it to see if it's something that we could either parlay into something that another vendor has, if this is something that we're willing to take on and could put into our kind of strategic roadmap, or something that we would even want to build maybe down the road. So we kind of have it, the go, no go as part of that. And then go through into our various security assessments if it's a net new assessment to that, to look at what it's really collecting, how it's being protected, seeing if our agreements are all up to date on that. So
now, is that including clinical applications, or do you have another group that looks at clinical applications?
We look at all of them coming through. So yes. So our chief analytic officer is, very versed in a lot of that. So I know he's got a lot of good components and background in that, especially as he's building that enterprise data warehouse. So we're doing a lot of that in-house development. So he's trying to see if this is something he can create at that subset, because AI is only as good as the data it's getting. So if that's something that's on his roadmap and everything that he's looking at, and we already know we have our data warehouse secured. So we're not going to try to create risks that we're not prepared for, just to chase a shiny, bright object. So
yeah. Well, one of the challenges we found is that setting the right policy balance with adoption of emerging technologies like AI with protections, so that obviously we can get ourselves into trouble if we go too fast. How are you thinking about that from your user community, especially where AI is such a great tool to increase productivity in many different dimensions of our day jobs, right?
And that's where we're looking at it from a use case perspective. So like Copilot has so much potential on being able to help us with just burnout, number of meetings, meeting minutes, some of these low hanging fruit stuff that isn't necessarily PII or PHI. So if we're able to get that really good, we can start to morph that into how else we want to use it throughout our various clinical areas and administrative areas. So, IT, data analytics, finance, HR, some of our support services, we'll look at really piloting it with them, because we don't have as much data as some of our clinical stakeholders, but also seeing what kind of technology would make sense for a nurse versus a supervisor versus, for our providers versus med assistants. So it's really looking at almost role-based access on how they would use it. Are they just users of it? Or are they able to, go in and manipulate data? So that's also tying back to our data governance program. So that really shows the importance of that, and good old-fashioned DLP. So, data classification and data tagging, and a lot of that things can get out of control pretty quickly if we're not, keeping a good pulse on that and governing everything. So,
no, I love that. And are you thinking about those areas of AI maybe to consider bringing in internally and building out your own infrastructure to deal with a lot of security and risk issues accordingly?
Yeah. So I know that there's a lot of, specifically to security, for insider threats and seeing just different anomalies. We're looking at that from one of our NDR tools that we brought in. A lot of the EDR agents have had that for a long time.
Yeah.
So looking at different anomalous behavior, but really seeing how that can correlate into SOAR. So how can we automate, do isolation? Because again, if it looks like a duck and quacks like a duck, it's going to be a duck for some of these low-hanging fruit or risks that we know about. So we're trying to see how we can action that with our security partners with various run books to, if X happens, it's got a 95% validity, based off of these other data sources. How can we automate that with various AI-based technologies on the security side? Because again, if we're using AI for, business operations, threat actors might be using that. We need to look at how we pivot to that. And we've even had to pivot to a more AI-based tool for our email and phishing security just because of the onslaught of what we were getting. So that's this emerging risk come up. We had to go out and look at, our problem statement as an organization that, we have the way of manually reporting. We have our SEG tools that look at this. So were they really meeting the threshold? Again, using data to go through and drive out to, procuring a new tool that integrates in. And we've seen a drop in almost 700 phishing emails a week and almost 6,000 a month. So that's where AI can, again, on the security side, go through analyze these emails very quickly. We're seeing emails still the most effective, threat vector out there. So again, that's something we're continuing to focus on. Still require our users are our front line of defense still. So we're making sure that they go through, we give them good training and awareness.
Yeah.
But still have this tool to, like the lane assist in your car. You can only do so much. So what we're doing to make sure to keep user error out. There's always going to be that human factor. So how can we supplement and keep our users from getting more of those fishy emails in their mailboxes? So.
How often do you do training? Are you doing it quarterly or monthly or?
We do we do our annual security and awareness training. We've been doing a lot monthly phishing training now with some good education into that, but we're also putting pretty complex phishing use cases out there. Our last one was add me on LinkedIn. So I got a lot of people that reached out and, I'm explaining to them what you probably don't have your LinkedIn tied to your Renown email, kind of using that good educational standpoint. So that's brought to light on some of these various use cases. And again, that's where I'm working closely with my chief analytic officer to more build out our phishing compliance and education program from this data. We have about 5 or 6 months of trending data. So let's start to look at, again, work streams. So our clinical users look like they're the biggest people clicking on things. So they need to receive emails externally. Is there more targeted training? Do we need to have additional discussion? So that's partnering from the data side, but also with our compliance and HR to start to look at from the human side, what do we need to do from a targeted training? Something that I create might not be something that translates over to a nurse and what they need to see. So we're going to try to take that out to see how we can continue to develop better training that better helps the end user to see what they need to look for, to provide them the tools to do reporting, not only for phishing, but for any anomalous activity. So
I love that. And last time we spoke, we talked about priorities. What are some of the adjustments you've made over the last 6 months or so to your priorities over the next 12 to 24 months?
So third-party risk still up there. So just growing out in the tentacles of that, getting into fourth party, looking at more of the continuity. So these CDRs even bigger on, making sure not only recovering a technology, if it's in-house or impacted by a vendor, but also the continuity side from having backups, having downtime procedures, testing, doing that a lot. Also, access management continues to be that vendor access management. I think us as an industry, if anything, Change Healthcare also showed information sharing, people doing various updates. And I think we're able to cut and sever connections, quarantine emails all pretty quickly out.
Yeah.
After us all just having, good discussions with peers on what's going on. So I think that that's getting better on events like this, just how you can, do some real-time information sharing with other health systems out there. And also, just getting more into automation. So it's like we're having a lot of these tools. People have had our EDRs, our MDRs, our NDRs, our EIEIOs forever. So how do we start to integrate these and get that real-time intelligence and quarantining that we've talked about that for a long time, but really starting to action these things, doing, true segmentation. And that's where we see a lot of potential with 5G, taking like a lot of our Volt and BYOD devices and other telephony-based devices in the hospital and just, moving that off, but also being a redundancy if we ever have a network outage. So, really exploring that kind of cutting edge technology to see how that can help segment stuff just by design on maybe putting legacy-based devices on that, having different VLANs and other pieces that we've talked about for MOT, IoT, and there's a lot of opportunity for that. So we're excited. And that was something that we look closely at HIMSS as well for putting together a roadmap for that as well.
Cool. That's great. So I think last time I asked you a bunch of personal questions, so we won't rehash those. But anything that's new on the personal side, on the personal front, that you'd love to share with listeners?
I get married in October, so that's going to be that might be the riskiest thing I'm doing if I had to go back. So I was excited for that. So
it is the riskiest thing, by the way, you've ever done.
Yeah. So on top of the day-to-day stuff, it's the wedding planning and all of that.
Congratulations.
The bachelor party also might be one of the riskiest things.
Hopefully it won't be.
Yeah.
You're not 20 years anymore. Yeah.
But no, it's been...
Stay out of Vegas.
Going somewhere warm with some sand. But yeah,
there you go. There you go.
Everything's been good. It's been, really enjoying to see where technology's going, really seeing the direction our organization's going. Our senior leaders are doing all of our strategic planning. So really excited to see, where our growth and key focus areas are. Because then that enables us from the security and technology side to help, put together our tactical plan to support the business. So some just exciting times in healthcare at Renown, and obviously leading up to the wedding. So.
Yeah, and you're not a kid any longer, but the kids these days, they don't do their honeymoons right away. Are you going on a honeymoon right away?
Right away, but that's our biggest discussion on that. I'm on. Us security professionals are always on our phones.
I know,
so especially adding in the CTO to the CISO side of the house.
We're
trying to see how long I can make it without getting a call or text. But
3 days weekend, and go like a Friday through Sunday.
But we're trying to do 7 to 10 days.
Oh, nice.
So we're excited about that. So I told my team there's a PTO freeze. Nobody else is able to go on vacation, and that we need to have everything, tied up. And it works well because, going back to Change Healthcare, I was out of office on a golf trip when a lot of that happened. Not that I wasn't getting texts and keeping close with my team, but being out of country, that really shows that was a good exercise to have some of my key security members to go in and get some good visibility and run with the exercise.
Were you in Scotland playing golf or Ireland?
I was down in the Dominican Republic.
Oh, Dominican. Oh, okay.
Yeah.
Okay.
So it was a good chance for my team to kind of have that, which goes into contingency and, other stuff that sometimes there's leaders that won't be able to be reachable. Yeah. So we're going to use that mentality and hope that it's a smooth sailing for 7 or 10 days with, knock on wood, no security issues or third-party issues. So
now, are you sun and sand, or are you thinking about doing to Europe, or like what do you tend to do?
Sun and sand. I think we're going to do Hawaii. So
that's awesome.
Yeah,
it's terrific. I just got off of a 2-week stay in Aruba. Have you been to Aruba?
I have not, but that's that's on my. We're going to a wedding end of the year there as well. So
it seems like whenever we're there, it's our 3rd year in a row, and there's always a wedding on the beach where we stay. So.
Yeah, excited to that.
That'll be nice. Yeah, excellent. Any last comments or thoughts for listeners before we break?
Great to talk to you as always, and it's all. Maybe when we talk again in 6 months, we'll see. See where things continue to progress.
Maybe after the wedding, we can do a wedding follow up. How about that?
Yeah. Definitely. Things will have changed.
November.
Yes. We're just waiting, to see what the next big thing is that Change Healthcare. Anytime something happens, it would do us a disservice if we don't learn from those.
We learned a lot from this one. This was they just keep getting bigger and worse. And, the tendrils that Change had in organizations. And I think, what was it? 60% of the hospitals that were affected were losing $1 million a day or more. It's just incredible in terms of the impact it had in a short period.
Yeah, and a lot of people probably didn't think that the level of magnitude of losing something like that. So, or how critical it was, and it did have downstream impact into insurance authorizations, the pharmacy side. So it's like, it had more of a patient care impact than a lot of people would probably have realized. So it's definitely an eye opener, especially as we continue our emergence to pushing more out to vendor partners, going to the cloud, the importance of, good security hygiene, and then having a good third-party risk management program to, it's same. That's not a question of when or if, it's when. So having that same mentality for your third-party partners as well. So that being a plan. So.
Be prepared, because the next one may hit you directly. And it's a great way to end the program. So thanks as always, Steve. Pleasure.
Checking in to talk to you.
Yeah, it's always great to talk to you. And I look forward to catching up with you in November after the wedding and the honeymoon.
That sounds great. Well, thanks again.
Thank you. This is Ed Gaudet from the Risk Never Sleeps podcast. If you're on the front lines protecting patient safety and delivering patient care, remember to stay vigilant, because risk never sleeps.